slides. So my name is Karen Armstrong. I am a physician scientist and a pediatric epileptologist at the University of California, Davis. This is a much more sort of clinical, interesting story than some of the really cool research talks that have been going on. But I'm so interested in everything that everyone's been talking about. So the title of my talk is Polyhydramnios and KCNT1 and in utero diagnoses. And the reason that this came up is that we had an interesting patient here who was actually diagnosed with KCNT1 variant before he was born. And so one of the things that had kind of brought on the prenatal diagnosis was genetic testing, whole exome sequencing that was done through GeneDx because of pretty severe polyhydramnios and macrocephaly. So just going to say just a little bit about polyhydramnios. So this is an excess of an amniotic fluid, and it's actually fairly dangerous for both mom and baby, and so sometimes requires intervention, like reducing the volume of the amniotic fluid. This occurs when mechanisms that regulate the amniotic fluid are disrupted, so that could be because of increased urine production or difficulty swallowing or having a GI obstruction. It occurs in 1 to 2% of pregnancies, and about 5% of those with severe polyhydramnios did have a significant genetic anomaly. And when we look at both the patient that we took care of here at UC Davis, but also in the literature, we saw that actually this comes up a fair amount, polyhydramnios, in the setting of KCNT1, and particularly with severe cases of KCNT1. So you can see a couple of case reports here of cases where there was severe polyhydramnios. And then in our case, we did have the polyhydramnios was one of the early clues that led to the genetic testing that came up with this diagnosis. So Ali was actually helpful enough and kind of brought this to my attention that this is a really kind of unique and interesting. It isn't really out there in the literature too much, but in particular, this variant here, which our patient had this recurrent variant, in which a lot of the patients seem to have polyhydramnios. And when we contacted GeneDx, they said that indeed, many of the patients with this variant, about a third of them had a history of polyhydramnios, suggesting that perhaps this is something, an early clue perhaps to severe disease. So in summary, all of the in utero diagnoses that we've heard about so far have followed polyhydramnios. Most of the cases that begin with polyhydramnios seem to be severe, and there is this recurrent variant that have polyhydramnios in up to a third of cases. So we're thinking about kind of putting this together into a study to say that, this is something out there. What are the mechanisms? What can we learn from this? So that's pretty much it. And thank you so much to Ali for bringing this to my attention and helping me gather the additional data that made it worth talking about today.